All right, Brian, should we crack on?
Excellent. Let's crack on, my
So,
friend.
so Brian, I'm sure to a lot of people here, you don't need much of an introduction, right? But I think it might be ideal for some of those of you that don't know Brian. Brian, you can share a little bit about yourself, what you do. That'd be brilliant.
Yeah. My background, I've been coaching for about 20 years professionally now. In some regard, it started from a basic standpoint of just being a trainer. My actual beginning began as a PT assistant, where we've discussed that, of which I quickly diverted because I was in one of those, just sheep shops that was rotating every. Yeah. So anyway, I was in school at the time and decided to go a different route, and I took what I was learning as an assistant in PT and the very basics of understanding like core development, compensatory actions, things like that. And I integrated it into some pretty intense work that I was doing as a coach. That caught enough attention to where I was coaching coaches, I think within the first 3 or 4 years of me actually training professionally. And so I picked up on that I think I'm doing something unique here that people are interested in. So I kind of started moving more towards a model of working with coaches and people that were really more interested in the deeper details of things. And that's what's transpired through my career and kind of creating a paradigm shift in the endurance world, which was about 2007. When that happened, wrote my first book, 2010, Power, Speed, Endurance. And then that's all transcended more toward, and that was all movement focused, right? And then using intensity with movement to understand it better and get better results with people. That's transcended into where we started looking at breath control and looking back on things like free diving and yoga, which are very, very old practices, and why we weren't using anything in human performance, even sports medicine. When I talk about that, when I say human performance, why we weren't really utilizing a lot of these tools, yet they have been around forever, especially yoga, right? And I had put on a training mask, and it changed the way I positioned myself and the way I was sitting. And so that continued to spin wheels, and my diaphragm. I just changed position because I needed access to my diaphragm, or my body made a change as a result of this, and that has continued to play into me going into the physiological components of things. So we looked at the mechanics in terms of breathing, we looked at the physiological side of things, and we got invested in the neurobiology. And so we could really understand where it's all at. So there's my background in that.
Yeah. No, it's brilliant. I mean, like I said to you before, I came across your work when I was still in college, right? Studying to be a physical therapist over in the US. And I think my second job when I was a new grad was down in Wall Street in Manhattan. And so I was seeing people coming into clinic bombarded with stress, in constant state of stress. And so as a new grad, you'd get stressed out every time you're doing a consultation for the first time, because in the back of your mind, you're thinking, what exercise do I need to do with this person? What stretch do they need? What kind of core stability drill do they need? And when I came across your work, it's sort of in the last 6 months when I was there, and I started kind of considering the importance of the client's physiological state. Like, are they in an ideal position? Are they in an ideal state to be able to adapt to the work that I'm actually trying to deliver? Are they in a state to adapt to the load that I'm trying to deliver, whether it be exercises, whether it be manual therapy, whether it be any kind of load delivery, any kind of stress? Because it all comes back to how we manage stress, right? How we manage the load imposed in our body. And so that was one of those middle PT clinics as well, where I was seeing like 3 or 4 people at the same time. So I had bands over my shoulders. I was throwing bands to everyone just to try and add load to something, right? Just to pass the time. But when I integrated the breathing strategies, the breathing patterns that you had taught me, unbeknownst to yourself, and just merged that with, and I think this is one of the issues where PTs and movement and rehab therapists kind of shy away from breath work, is because sometimes they don't find it accessible because they think that's all they might need to do.
Yeah.
Right. But if we can actually think about just superimposing breath work with basic loading strategies, that's where I think we can have a massive influence. And it completely changed the outcomes that I have with clients. Just getting them to focus and tune into their breath, and then not necessarily searching for the next magic bullet, the next magic exercise. Because I think at some level, all of us rehab and movement therapists now understand that we haven't found that magic exercise yet. We haven't found that magic bullet, and we're probably not going to find it, right? So the kind of low hanging fruit is the client's physiology, because they're coming from a world that you don't know. Like they're coming from home, they're coming from work, they're coming from outside your control, your certain clinic, which is very certain, but the real world is full of uncertainty. So what I got from your work initially is that what I was doing as a physical therapist wasn't preparing the client for real world movement. Right? I wasn't actually targeting all those layers that are necessary for them to take what they've learned in the clinic outside the clinic door into the real world. And that's where I think a lot of the focus needs to go nowadays. But we need to sort of make it accessible to therapists and to anyone out there that's watching now with any kind of pain. It needs to be accessible, and it needs to be easily implementable from a daily routine standpoint, right?
100%. I mean, I look at, the in the box stuff, the things that we all, that you all learned. And, I grabbed onto very early on. These fundamental exercises are things that we put our clients through, or our patients through, as these are, they shouldn't be rigid. They're just the kind of a foundation for creativity and understanding where they originated from and why we're actually using these patterns, right? But the one thing that's universal to what we're actually trying to elicit is what's happening, is why we're using ventilation. We have to have oxygen in order to function. With physiology, all physiology needs oxygen. That's the deal that was made 100 million, or 2 billion years ago, right? Like aerobic metabolism took to the forefront of evolution, and this is the most efficient means of doing things. And so thinking that it has to be very complex is why so many people stay away from yoga.
Yeah. And that's why I think like we as therapists, and we as people that are trying to influence movement, we are the ones that overcomplicate it. Yeah. Because really when with IKN, obviously we're interested in the neurology behind things. And really when you break it down, your brain doesn't know that this is your bicep, this is your tricep, that's your quad. All it responds to is neural load. It responds to stimulus. And so are you giving it enough stimulus to adapt, but also is it getting stimulus from all the layers so it can share stress? And so I think that's a hugely important thing, is that we need to understand that your body is always being stressed. Like gravity is always trying to pull you down. Like respiration and gravity are the two main sources of stress to your body. So that should always be going on in the back of your mind whenever a client comes into your clinic for the first time. Is how are you going to influence the respiration, and how are you going to influence their ability to manage gravity?
Yeah. Right? These are fun. That's absolutely fundamental in my upbringing, was gravity. Like, hey, you know what they're not talking about is gravity. Yeah. And yet that's what's affecting everybody, right? And so the first thing I think about when you say that is like, look, gravity is a constant. Yes, it is. And we don't even totally understand it, but we're fighting against it at all times, right? So what do we do in order to relax or rest from gravity? Yeah. We lie down. Yeah. You don't stay standing up to sleep, right? Although I know a couple people who've pulled that off in ultra marathoning, but the fact is it's like just considering that, going, if we think of the most simple ideas around this, we can then explore it in a way that allows us to creatively change things. And I think that's what our goal and my goal has always been, is I'm going to go really, really deep into this thing because I'm so interested in it, and it has so many things that are going on with it. And I think the real attractive thing for me is that nobody was looking at it in the capacity that we saw it at the time. Right. And it's not that nobody's looked at in all of the ways, but the fact that we were able to connect a few things that I think are being very, that are being brought to light, something like CO2 tolerance. But it's a fascinating thing, because we tend to, because of our education and what we learn, tend to think we have to overcomplicate things, and breathing is not a complicated thing. But unfortunately, most of us are in this very compensatory, this very big compensatory state that we all live in to a large degree. We're all complicit in it, right? Like, we're supposed to be out there, right? But we're not. And I'm not suggestive that we need to go back out there, but the fact is we have to understand what it is being out there gave us, and how to use that here.
Yeah. And that's why I think as a movement and rehab therapist from our lens is that like
Yeah.
you should always be looking at what are those big rocks that an individual needs to prepare themselves, or to at least allow themselves to be robust with real world movement. You need to step back and understand, okay, they're going out into a world full of gravity. They're going out into a world where they need oxygen to be delivered to tissues to allow them to adapt. And so let's say, for example, a kind of a client walks into the clinic, right, with low back pain, and they seem stressed. You know, they've done all the stretching, they've done all the exercises that they need to do, right, and they haven't really created any kind of change or facilitated any kind of influence over their pain experience. And so we need windows to get an insight into their ability to manage gravity. We need windows to get an insight into their ability to manage their breath and manage their physiology. All right. So I think if we could kind of talk about some of those with our listeners, about some strategies that we can maybe use to get a window, or even open up a couple of windows into a client's physiology, to step back and say to yourself, okay, instead of thinking, what stretch do I need to give this person? What manual technique do I need to use based on a course I took? What exercise needs to happen? Let's think, what are they in an ideal physiology to be able to respond well to my load, to my exercise?
Yeah.
Right. And so I've learned a lot of these from you, and just to all the listeners out there, like Brian has had a massive influence on our approach at IQ, and that's why we wanted to bring him on here, because to share this stuff with you in more detail, understanding the physiology behind it, because it has had such a massive influence on how I approach treatment with clients and how we teach all the therapists that come on our courses. And so we can kind of go into some of those, Brian, that would be brilliant, and we can kind of we can go
for
as well.
Absolutely. You know, and I'm, you know, I'd like people to kind of understand that this is like a two-way relationship that kind of was going on prior to actually any of this occurring.
Yeah.
Because I was following you guys, and I'm for very good reason, you know, and Rob actually introduced me to what you guys were doing. And I was like, whoa, okay, this is a very different approach to looking at how to deal with treatment of people, PT. And so I appreciate, I mean, most of the reading I do at this point is basically on the nervous system and the psychology, because I understand.
Everyone always makes that drift to the nervous system when they realize there's not, like that stretch is not helping, that manipulation, that mobilization is not helping. Why? Because you're dealing with a unique nervous system, and you can never predict the outcome of a human that's evolved over millions of years. You can't predict
this. It's this structure that wants to be autonomous, right? It just wants to go on autopilot. But the only way to change that is to consciously get involved in it, you know. And it's like, how can I help this person consciously to get involved in this, to make the changes so that when they do go on autopilot, it's like, hey, magic, I'm not in pain anymore, right?
Exactly.
Yeah. So I mean, just with regards to like where people I think should start, I mean, you want to start with questions, or do you want me to just dive into kind of some of the stuff, or you go ahead?
I think what we can do is, I mean, when a client enters my office for the first time, I always want to get an insight into how is this individual managing stress. And so we have to step back and understand what are the main sources of stress. And one is gravity. So we do certain things to see how they're managing gravity, but also we understand that they're breathing 23,000 maybe plus times per day. So that's a lot of stretching around the rib cage. That's a lot of movement in the organs of the body. That's a lot of that's a lot of reps, you know. And so we need to understand, are they able to tolerate load well through their respiratory system as well? Because I think as therapists, we all understand we need to load muscles, we need to load joints, but we don't understand that, look, the respiratory system needs to be able to tolerate load as well. And so we need to have some kind of window into identifying the client's capacity to be able to handle that load. And so I know I kind of go through strategies that I learned from you, but if you want to kind of maybe even talk about like the max exhale test, to test the client's tolerance to carbon dioxide is a huge one. Why want me to do that?
Yeah, for sure. So first, a lot of what I'll talk about, although it's a lot of theory, there's research that's actually starting to come out that we've had done in thesis, that it's going to IRB. There's things that are going on. I'll try and refer to whether this is theory or not, you know, but I do take serious, like I'm very serious about my work, so serious that I start it and then it goes out to people who are willing to play before it actually gets any public attention, right? So meaning we put it in front of a lot of people. And then I've got enough friends in research and science that are actually interested in these things and want to take a look at these things and help us understand and validate these things. So we critique our work. We have it scrutinized consistently. And we do it on purpose because we want to understand, we want to learn, not because I'm looking for a specific outcome. I'm not talking about breathing because I thought it was a hot topic, even though it's kind of one of the hottest topics. We're actually responsible for making it one of the hot topics, right? Like, we're not the only one. Like, there's definitely guys like Wim Hof who've been doing that, right? So CO2 tolerance, I think, is the basis of understanding, for at least for us and what we're looking at, and most people who wrap their heads around it. So CO2 tolerance is by far the most easy thing to identify with somebody from a physiological and psychological perspective of how they're handling things and what kind of state they're in.
Yeah.
Right. Mechanically, as PTs and as coaches, you should have an eye to be able to see, and you'll understand this one. When somebody walks in the room to me, I know what kind of an animal I'm looking at and what I'm dealing with. Right. I sit in airports and it's just a field day for me, because I'm like, it's almost like Disneyland, because I'm watching all the dysfunction and I'm like, oh, I don't mean that in a negative sense. It's like, man, we are such an incredible species. Mm-hmm. We can adapt to anything. So that said, CO2 tolerance is one of the easiest ways to understand this. We did not develop this test. We stole it from the freediving world. We stole it because what they've done is pretty incredible with their own physiology. And if you go look at the freediving community, by and large, most of these people do not look like unfit individuals. Yet if we were to put most of them in a working environment, they'd fall apart a little bit in a work, like, hey, let's do some strength and conditioning work. They're going to fall apart to a large degree because they're so specified in what they do, but that doesn't mean don't take a look at what they're doing. So we spent plenty of time there. I work in that world a lot, like, a lot of CO2 tolerance work, low O2 work. But the thing is we started to see a very big trend towards CO2 tolerance scores, low ones, and psychological reactivity and physiological and mechanical reactivity, meaning I've got tissue that doesn't respond. Mm-hmm. I've got people who aren't responding very well, or very anxious, very panic oriented, or dissociative in a big way, pulled back, hiding. And that was the big work that I actually did with Dr. Andrew Huberman a number of years ago. Was we took what I was already doing and did it with a screen that they were actually applying through emotional reactivity. And so and that's gone as far as Preston Spearmont out of Dr. Andy Galpin's lab, running his thesis, which is now headed towards more to getting validation through research on CO2 tolerance and state anxiety correlate. And in his he was able to absolutely prove this, which was something we already knew, right? But we needed to go further. That said, CO2 tolerance is our ability to tolerate carbon dioxide at a physiological level and psychological level. So I'm actually getting a 3-part test, meaning how well can I contract my or eccentrically contract my diaphragm on an exhale, mm-hmm. because we're using the nose only. I'm not pursing my lips, so it's no mouth involved. How well I tolerate the rise of carbon dioxide. I'm going to exhale a lot faster if I cannot tolerate CO2. Yeah. Psychologically, how much load I have on me, how much stress I take on, suppresses my ability to actually tolerate that CO2. So the max exhale test became this open door to, wow, mm-hmm. like, this person is really reactive, or they're actually hiding their reactiveness. Mm-hmm. Mm-hmm. But when they do the test, I actually had I understood why they were blowing up on a very simple exercise that they were doing, because any metabolic load, so this is the thing with CO2 tolerance, is I suppress it from an ability to cycle. Like, if I'm thinking too much, if I've got too much going on in my life, I'm suppressing that ability to tolerate it, right? We don't correlate that to, if I go exercise, that could be a problem. We think the exercise is something that's going to make us feel better as a result of this. But the problem is that from a metabolic load standpoint, cellular respiration goes up. So now I've got this waste product coming in, and now my head, I can't talk. So now I'm metabolically setting myself off into more anaerobic processes, more carbohydrate being used as energy, more stressful response. This turns me more sympathetic very soon. So when we see low CO2 tolerance scores on a max exhale test, that would be something like under the range of 30 seconds. You're seeing a fairly reactive person. But this is not necessarily a bad thing. I see this as such a brilliant opportunity because of the amount of people that we've seen in these low ranges and what happens when they get up into the higher ranges. Their lives change because they're now using the oxygen in the system. So,
I think it's like from what that test is, it's essentially seeing how long you can exhale, right? You're taking a gentle breaths in, you take a deep breath in at the end, and you try and exhale for as long as you possibly can, right? And so, like you said, you're getting a couple of things there. Is you're actually allowing for the diaphragm to eccentrically lengthen. So there's a lot of skill attached to that, because I know some people tend to compare the controlled pause test, where you're just taking a gentle breath in, and then you exhale lightly, and then you try and hold your breath for as long as you can. And then there's certain ranges there, but there's no skill involved in that. Anyone can just hold their breath. But by you doing the max exhale, the max exhale test, what you can use that to frame it as you're getting an insight into the client's ability to control all the stuff throughout their rib cage, throughout their diaphragm. And so I think it's a lot more accessible for the client to get an insight into why you're doing it, instead of just having them hold their breath and seeing how long they can hold it for.
Correct.
So I think it's a great, I do it with every single client of mine. And even sometimes you don't have to do it at the very beginning of an exercise or the beginning of a session, but you do it with the first exercise that you're doing to give them an insight into, hey, it's actually quite difficult for me to coordinate my breath with this movement. And so that might be something that I might want to improve as well, because that's going to influence how well I respond to that movement. Right. So I definitely think that's important for people to understand, is that there's a lot more skill involved in doing that max exhale test. Right.
Yeah. So, and I saw Tomas, who is a friend of ours. He actually put up a link to the breath calculator on our site. So if people, and there's people asking to demonstrate it, it's really simple. Actually, but we complicate a lot of things, but it is it's simply the ability to prolong an exhale as long as you possibly can. Right. And doing this by calming yourself down. And the reason we didn't stick with a bolt score, which, the bolt isn't bad, but it's so subjective in trying to identify the first instance of the first feeling of needing to breathe. Well, I don't know what that is.
Exactly. Yeah.
That's like, right. So then I've got to guess for a few times what that is before I've created some patterns in the brain to actually say, okay, that's what that feeling is. Even though that may not be the feeling. So, but the thing you can't hide from is prolonging that exhale and getting it longer and longer and longer. And what we've seen with a lot of people is do it 3 or 4 times in a row with some controlled breathing between to calm you down. And you'll get some of the nervous system, you'll get better motor control after doing it a few times, because there's going to be some mechanical things, but by and large, once you hit that plateau with it, that highest range, you've got your number. And then the only way to change that is to better understand how physiology works and how oxygen really is available. And that's the Bohr effect, right? And that's why we use breath control with what we're doing. It's not everything we do. Like there's at points in training and things we're doing where we want to be able to express things. But the fact is, controlling the one variable responsible for how all physiology is going to interact is going to have a profound effect. And that's what we've seen with with across the boards with who we've worked with. And actually connecting this into, hey, I've got somebody who's in restriction with breathing, right? If I'm trying to get somebody internally rotated here, like they're missing internal rotation, right? And it's like, if I'm having them follow a breathing, like as I internally rotate, I'm exhaling, but that exhale starts to get choppy and they can't exhale as well.
Mm-hmm.
Well, I already know what's going on because this is inhibition of sympathetic state, right? And we talked about this with the cold, right?
Yeah.
Where the reason I really use the cold is to understand where we have control of our autonomic arousal. And my breathing is a direct component into that state. So when I'm working with an individual and I see they can't control a breathing pattern, it's typically on the exhale. It's never really on the inhale, man.
Mm-hmm.
Even though, like, if I'm controlling a long inhale, there could be a problem. But if it's a fast or that's never really the problem, you know? It's always on that exhale to where we start to see that inhibition of sympathetic tone being not able to grab on. Exactly. So that breath becomes quicker, right? Yeah. So then we've got a hyperventilation happening.
And I think that's a really, really important point as well, is that what I see in clients with persistent pain is that I'm not going to say almost all of them, but a lot of them have a very poor ability to prolong their exhalation. And you can even think of it from a respiration standpoint, but also a gravity standpoint. Like if you want to manage gravity easier, are you going to exhale or are you going to inhale? Like if you're a powerlifter and you've got hundreds of pounds on your back, are you going to want to exhale all the way, or are you going to want to inhale, fill your body up with pressure? Because when you do that, if you're sitting in your chair now, if you fill up your body, it's much easier to manage gravity if you hold at the top of the inhale, right? And so when you think of one of the biggest threats to the nervous system, it's falling, right? It's actually falling flat in your face. So when you exhale, you actually have to flex your rib cage, depress your rib cage, internally rotate your rib cage, so you're actually moving into a falling position. And so sometimes I even think of that it's a timing issue. Like people aren't giving themselves enough time to exhale. And so they're always kind of stuck in this kind of inhaled position. And so even just get from a mechanical standpoint, getting them able to load each end of the spectrum with an inhale and an exhalation is really important. But we have to understand that when you move through an exhale, that's when carbon dioxide will build up in your body. And sometimes an individual that hasn't been exhaling for a long time, they might be very sensitive to that. And so we just have to consider that. But also, even from a standpoint of managing gravity, like your rib cage internally rotates. When you internally rotate your shoulder, that's going to bring you further into rib cage depression. Right? Yes. If you want to yield gravity, you want internal rotation at your lower limb. So internal rotation, lack of internal rotation oftentimes is expressed in terms of the inability to manage gravity well, because we're always trying to externally rotate everything. So we're trying to inhale, we externally rotate our shoulders, externally rotate our lower limbs so we can manage gravity easier, but it's not a sustainable way to manage gravity. So you can see all these things as it relates back to the breath and our ability to move through inhalation, exhalation. And I just find that fascinating. That all kind of kicked off from your work and just feeding that into the movement and kind of rehab world as from a physical therapist standpoint. And I think that more people need to really understand that.
Yeah. I mean, there's a reason why yoga inhales into extension and exhales into flexion, right? Yeah. But I mean, granted, I can't say all positives for yoga at this point. I mean, because a lot of it's been so bastardized and so changed, just for the woo of it and the feel good of it, versus understanding that this is about asanas. This is about challenging a position and understanding what you just explained is my fight against gravity. That's all this is what does that feel like when I hollow myself out versus, because that's what we're doing. We're hollowing out but creating this space in order to be in a better position, right? When I'm full. Yeah. So that if I did have load on me, versus if I've got load on me and I'm compressed, that spine is now in some serious compromised place if I don't understand organization. And that's where it comes in, is like, do I understand the organization of my spine in order to make it so I can get the thing responsible for moving energy? Yeah. Because I can't move energy, isn't it? Yeah. It's all energy. Like,
even when you think about it, like if I take a nice deep breath in and my rib cage elevates and expands, what's happening at the spine? Your spine's moving into more of a closed, packed position. So there's less variability there. So when you have less variability, it's easier to manage gravity because you don't have to understand lots of movements, lots of degrees of freedom. You're lowering the degrees of freedom, the movement variability. So it makes sense that a lot of people don't want to get out of that. They like to stay in an inhaled position. But so I always think that whenever I'm trying to challenge an individual with a load, and we do an awful lot of isometric loading, specific isometric loading with IKN, but another way to challenge an individual's ability to just challenge their response to stress and create some kind of adaptation is to really focus on the exhalation phase. Because I almost think as the ability to exhale is just an extra challenge to be able to manage gravity. Right? Because you see people when you're doing an isometric load, they'll do this. And the exhale will be a little puff. And
it's scary, man.
I want. Yeah, it is scary.
Scary. Yeah. Because that's the thing. I mean, look, I just got pinged with a paper off of academia that was about conditional fear response breathing. We condition a response for fear breathing that is a pattern. And so this pattern is, look, we all deal with this, but it's the panic switch breathing. And so that is the panic switch breathing. It's where I'm afraid of I'm my breath pattern will dictate where I'm at. And this is what you're doing is you're taking your clientele, you're taking these patients to a place to where they're comfortable and they can understand, but then exposure through isometrics and breath control. This is going to make Rob really happy. He's playing around with a lot of this stuff right now.
Yeah.
I mean, you talk about you guys have blood flow restriction. Like that's a big thing now, right? Well, blood flow restriction, the easiest way to manipulate that is through isometrics and breathing.
Yeah.
And take all other tools away. And if you actually get into isometrics and breath control, you're now stepping into a very interesting world of cellular response to something that is being in this, a very tense state. But if I'm training a pattern, the one thing going to be responsible for how I'm organizing, the physiology, and then even the neurobiological, the psychological component is now wrapped into this to where I'm now getting somebody to be okay through breath control, and that dictating, hey, this is when we stop. When you lose control here, guess what? Done.
Yeah. And that's where I came across your work as well with the gear approach. You have the gear system in terms of, okay, the client's expressing this kind of breathing strategy and talking about the state mismatch, right? So let's say, for example, I'm doing kind of a low level isometric loading strategy with the client, but they're breathing as if they're running a sprint. So there's a mismatch there. There's a mismatch between the energy they're expending and their metabolic demand versus the task demand, right? So I think a large part of therapy needs to not look at the black and the white, because I think when clients come into our clinic, they look for black and white. Am I weak or am I strong? And as therapists, we think we're doing manual tests and we're seeing, is this client weak or strong? But it's about what's happening in the middle, that gray area. That's the most important thing. And so I think we can gather so much more from breathing to understand, is there a matching effect, and really putting a bit more focus on that when we're actually rehabbing an individual. Is their breathing pattern matching the actual task demand? Because that's going to be important in terms of how well they adapt to that. And so can you kind of give the listeners a bit more insight into kind of how you develop the gear system and
yes,
and how important it is?
Yeah. It was originally Rob's idea about this, which was, kudos to him. We're really fortunate that we found each other because he had as much of an interest in this as I did. And so we've taken this idea that he started with, and it's become kind of the basis of understanding what's going on metabolically, regardless of where I'm at. And here's why. It was without a doubt, and we continued to test this on metabolic carts, and that anytime that mouth opened, that there was a different source of energy being used. And this is how we, gas exchange is how we understand metabolic load and what's going on, and RER and all of these things. And, whether I was sitting down or went for a walk, if my mouth opened, I inevitably ended up flipping the switch to something else. And a lot of people kind of argued that at first and saying, well, that's not necessarily, you can't, that's not how it really works. And it's like, well, actually it is how it works. It is a, it's not a, it's like this chicken or egg concept. And the fact is in a few breaths, if I'm breathing through my mouth and there's not enough metabolic waste occurring, the cells no longer have the availability that they had from a global perspective to oxygen, because the blood now starts to change because I'm offloading unnecessary amounts of carbon dioxide. This is the Bohr effect, right? And so when the gear system came into play, because we started seeing that in our own work, that if I was working at 200 watts, let's say, and I was in a gear 1, which is nasal only breathing, equal in and out, right? So that's, one equal in, equal out on my nose. If I switch that to mouth, I completely switched what I was using for energy. I went from almost an 80% like fat utilization down to like almost nil fat utilization. And that was just simply at 200 watts, which is something I, a lot of us can hold fairly easy, right? Take that away. If I go for a walk and I'm doing this, it changes, right? So the gearing system came in as a strategy to understand what's going on metabolically, because we've been using heart rate as this for quite some time, which is a completely inaccurate thing. It's just heart rate became a correlate towards the gas exchange ratio that was happening at the time. And heart rate's great for understanding intensity. It's like the tachometer, right? But it's not what's happening from a fuel standpoint. And so we started to see that when we actually would ramp in, gear 1 would be an equal in and out nose. Gear 2 becomes a directed, very, it becomes a fast inhale and a relaxed, more exhale, right? Gear 3 becomes a very focused in out nasal only. This means we're flipping into more anaerobic processes, very simply, when developed. And then gear 4 becomes this, because it becomes real easy to offload a lot of metabolic load from that standpoint by now engaging the mouth. Gear 5 becomes the full anaerobic, where we are in a state of needing faster oxygen into the system, where, and to offload that carbon dioxide, right? So that we're at a point where the oxygen coming in really is no longer being used as a source of energy. We know it's now being used to buffer the acidic processes that are going on because of anaerobic cellular respiration. And so that becomes the means for understanding where we're at, right? Through metabolic load. Now, take this into, how am I training the individual? What am I looking to do? What's the intensity that we're using with them, the load with that? And then, hey, what's their strategy for getting back to baseline, which would be a gear 1. And that is, hey, gear 5 back down, baby. 5, 4, 3, 2, 1. How you doing? And this can be done at very high levels with very elite athletes. It can also be done with just your general population trying to better themselves.
That's really important, because like whenever a client comes to see myself for any kind of pain experience or movement restriction, I always want to make sure that when I'm loading them, they're at a gear 1, like they're nasal breathing only, because then I'm sure, or I can't be sure, but I know that their physiology is in a better state to be able to adapt to the load that I'm actually delivering through an isometric load, right? Because the nervous system responds to moment feedback, and that's why I think isometric loading is so important. And there's different features of isometric loads as well, and we can talk a little bit about that too. But gear 1, nasal in and out at a specific tempo with a slow ramping isometric drill, not going from 0 to 100, but looking at loading the individual isometrically from the same gear system, not going from bang, putting the gas to the foot to the gas pedal, but slowly allowing the individual to build tension slowly, in a way that we talk about at IKN, your ability to estimate the right amount of force necessary to do something, right? So like if I want to reach and pick up something here, for example, all right? Am I coming through there okay?
Yeah, yeah, yeah. You there? I got you.
Right? Am I coming through there okay?
Yeah, yeah, yeah. I can hear you. You hear me? Uh-oh. Ryan, you there?
Hey, can you hear me okay?
Now I can.
Sorry about that,
There
guys.
you are. They
um,
took a commercial break.
yes, my apologies. But what I was speaking about there is that um, when we're trying to apply an isometric load, it's not just about looking at it from a loading standpoint, but it's looking about it from how the individual is responding to that load. And so I will always have the individual nasal breathe first at a very specific tempo, and use
Mm-hmm.
specific isometric strategy initially to allow them to build tension slowly, in a way that mimics what happens with the breath as well. And so there's two kind of isometric strategies. And the reason I want to talk about this is because we want to try and link this to musculoskeletal rehab in a way too, is that if I take a deep breath in and I hold, that puts me in a better position to overcome gravity. All right. So I'm overcoming gravity by taking a deep breath in. And we all know about overcoming isometrics, where if I'm trying to press into something that's immovable, I'm trying to overcome that immovable object. But we also have yielding strategies, where again, if I'm holding a kettlebell out in front of me and I'm trying to express an isometric strategy with that as well, I'm trying to prevent movement there. Right, so I'm trying to yield that. Something's trying to lengthen my tissues and I'm trying to yield that. So I would view the exhalation as a yielding strategy as well. So I want to get the individual better able to manage gravity, not by overcoming it, because that's positive work. That's almost geared towards more of a concentric strategy, where it's positive work. You're utilizing more energy to produce a change or produce movement. And I think when you were talking about there with the gear system, is that at least from how I look at it in a rehabilitation setting, is how much energy is the individual expending when it comes to movement. Right?
Yeah.
It's such a missing link. I think that when it comes to athletes, if you've seen
Yeah.
a sprinters movement break down, you're thinking, okay, yeah, their energetic expenditure is too much and they're not very efficient. But we tend to forget that when it comes to an elderly woman with hip pain. We need to consider the energy they're expending.
Who can't lose weight,
Exactly.
but she's working so hard.
Yeah. Yeah. There's so much going on there.
Yeah. You have an answer right now. You have somebody who's so sympathetically dominant and using so much more of these anaerobic. They're so stressed that the system can't let go. It can't go into a more functional way. It can't move into a more functional manner. And this is exactly what you're explaining. It's like, we'll use this. Like, I mean, look, I used this yesterday. We were doing some big training exercise here. And part of it, I'll always implement these isometrics where it's just, hey, we're holding in a plank, but you've got to utilize a full gear one, right? Meaning all the way in, all the way down. And you're full gear one for like a minute in a plank after doing something high load, right? So you're being challenged from something where you're here, but then you're going in and having to force into that whole phase, and you can't change position, right? You can't, all of a sudden, the moment you start to give that spine up or you give up that rib cage, right? It's like, oh my God, I can't breathe now. And it's over. And it's like, yeah, you just got exposed. This is perfect, right?
The interesting thing from a neurological standpoint is that, as well as that, when you look at yielding versus overcoming strategies, like we would think as an overcoming strategy akin to more of a concentric strategy where you're trying to overcome force and produce force, whereas the yielding strategy, you're trying to resist to prevent it. When you look at the research around that, yielding strategies or eccentric base contractions actually have much more of an influence over the sensory motor properties of the nervous system. So the nervous system actually has to expend more awareness as to what's happening with an eccentric strategy, right? And you can think of that from a variability standpoint. Maybe, again, we're holding a lot more air in our system. Maybe we're trying to reduce variability because it's, in the short term, it saves us energy. But if we're trying to actually adapt and move and get out there in the real world and express movement in a positive way, then that strategy is not necessarily going to work. And it's definitely not going to help us out if we're expressing some kind of pain experience, if we've got discomfort or movement restriction in a certain area. And so that's, we look at those features of isometrics as it relates to breathing and as it relates to the movement capacity of your tissues in the body too, and how that comes back to the gear approach, right? And I think it's so important to look at that nasal in, nasal out from a tempo standpoint. And it's so simple to manipulate that.
Yeah.
I was telling you as well, I think a lot of therapists exercise.
I mean, it's so, and it, you know, I mean, here's something universally speaking, and this is kind of on the underground of the world of CO2 tolerance, because there's a lot of people who've been looking at this for some time. And, you know, we'll have one of the guys who actually has pioneered a lot of the understanding on this, Dr. Peter Litchfield, on our next webinar with Dr. Justin Feinstein, who's looking at it from the brain's perspective. But it's that the moment we become hypocapnic, which simply means I've lost control of my breathing, it's over. Psychologically or metabolically or mechanically. We are going to see across the boards that people are literally, it's just this. And so this gives way to the understanding of like breath control. Why it's so important is understanding something that if I don't have control of my breathing when I'm actually engaged in something I'm trying to learn, then I am just going to go to default. And for some of us, that's okay. But for a lot of us, that inevitably turns to something very different and that we don't enjoy. And so what we don't understand, we can't control, right? And, you know, this is Fergus Connolly right here. It's like what we don't understand, we can't control. Even if we could control it. But if we don't understand what's happening, we're just, and so this is where understanding these gears and this play and understanding breathing patterns. And when I switch, the most basic thing anybody can do. And this is how simple a breath practice is. Is just learn the difference between nose and mouth breathing. That'll be the foundation of everything. Yeah.
And you know what, like it comes back to that whole understanding, like you can't learn unless you understand. And so if as therapists we're trying to constantly overcomplicate our strategies when it comes to helping an individual with pain, we might feel like, oh, I'm very smart and I'm using a very complex rehab strategy that looks cool, but if the client doesn't understand it, you're not going to really create any kind of learning effect when they go out into the real world. It's sort of this difference between practice effects and learning effects. Now, like in a clinical setting, you might get better at doing a movement because it's a practice effect and you've hyper-cued them to do it. But when they step out into the real world, have you actually prepared them to understand it, to learn it, and then take charge of that from a long-term standpoint? And that's why I think it needs to be simple. And that's where I think the power of breath coordination comes into play, and really trying to tap into that breath while you're working through some specific loading strategies. So don't forget about the movement, but just think about, okay, what kind of breathing pattern is the individual expressing? Does that give you an insight into how they're managing gravity? Does that give an insight into how they're managing stress, which is basically the same thing, because gravity is the most consistent source of stress acting on your body at all times. So you're getting a quick insight into that already. But how can we make it simple in a way that the client can understand it and then take that out into the real world to produce the long-term change, you know?
Correct. Yeah. And I mean, this is, I mean, I get my type A'ers. So when we deal with corporate, folk who are high achievers, it's like, look, you got to understand, you're talking all day long. Your tissue, your system is stressed as a result of that. Even though this is your job, it's understanding what to do when you don't need to be talking. And that's defaulting back to, I switch that energy back and drop back down, right? And it's just a simple way of just pulling back in and getting people to understand, so that look, Dr. Norman Deutsch wrote a book called The Brain's Way of Healing, and in it he identifies like the sources around pain and what happens with people who are in chronic pain, regardless of what that is. And they're dedicating 15 to 20% more of the neurons in the brain associated with pain than those who don't experience chronic pain. And it delves more into, it becomes this phantom limb type syndrome, but the patterning becomes complicit in when we look at any disease out there where we do have pain, we do have inflammation, we do have something going on in the system. We see respiration rates that are double, if not triple, the rate of what normal breathing should be. This simply implies that we can change how people not only experience but perceive pain when we can get them retrained with a breathing pattern, because they're changing the actual chemistry in the system when they actually get better control of the breathing, better control of the CO2. I mean, there's a reason why we hand people a bag when they're panicking, right? It's I mean, it's not rocket science, but the fact is you actually vasodilate. You actually open up the system to use things more efficiently. You're not constricted. You're not in this heightened arousal state. You're more calm. This is everything a PT wants. Like out of a,
and even like understanding the mechanics of it as well. Like your rib cage is the most plastic part of your skeleton. It's the most malleable part of your skeleton. And so do you think it was really designed to be stiff and rigid?
Oh,
probably not.
And how many stiff and rigid rib cages are we looking at? It's just, I'm like,
But even that's a nice insight as well for clients, like, and for therapists, is that when I am doing some kind of manual assessment, if you're assessing the rib cage and you feel as though it's lost its springiness, right, you can pretty much assume that individual has lost the ability to exhale very well, right? Because again, they're full of air and they're kind of already kind of holding a lot of pressure in the system. And so my goal is to be able to get them out of that position, regain some of that flexibility, some of that adaptability throughout the midline as well. And even just going back to your gear system too, when it comes to like people with a neck pain, just so we can kind of fit this in there for people who work with people in pain, is that one of the key things that I found from your work that really helps those with any kind of tension around the neck and shoulders is the ability to slow down the inhale. Right, because when you're taking a quick breath in, you'll feel these accessory muscles kick in with high tempo, and you'll see those clients taking a very sharp, quick breath in. But if you just allow them to experience load through those tissues, whether it be upper limb or around the neck area or with a breathing drill, and just allow them to really slow down and make the inhale very, very quiet, that can be a game changer.
Yep. Right? That's I mean, Dan Brule, who's been doing this for a long time. That's his thing. He likes the inhale process. He likes really focusing on that inhale process. And I agree. I mean, I think you should be able to have control of your breath in any way, shape you need to use it. This is the beauty in understanding how breath control can work for you, and where the creativity in this, like, we're simply putting out principles in understanding this. We have no real methodology we're doing, although the gearing system could be looked at as that to some degree, but it's really, hey, what can you do with this stuff in order to manipulate the creativity around it with your clientels, or, you know, with your clientele, with your patients, with your people you're working with yourself, right? And that's, I think, the most important part is people really, you know, especially PTs, you know, like people in sports medicine, you've got to be playing with this stuff yourself. You've got to be this experiment of understanding so that you can wrap your head really around these things and explore those edges of where you're prescribing things for your patients and understanding where we can manipulate things. And I think this has become the biggest variable of change we've been able to see, which is why we're so hooked on it. Is this has actually made things, created opportunity for people that they never knew existed. I mean, I've got friends who've been in this world for 20 plus years that come to me on a routine basis, and they're like, I just PR'd something that I don't believe I was working harder at, but because of breath control and my everything changing in that aspect, I'm not only moving better, my tissue responds better, I'm more mobile, but I'm working more efficiently physiologically.
Yeah.
Right.
Yeah. And like, I always explain to the client, to an individual who's in front of me with any kind of pain experience, where it's not about the stress that's kind of acting on your system, but it's about how your body is responding to it. Your body, your brain's always kind of estimating the capability of your body. So I always kind of use a strategy where I'll say to the client, where it's not about, if stress exceeds your capacity, it's not that you get injured, but it's that the nervous system feels the need to express protection, right? And protection can come about in the form of pain or high tone. But I'll say to them, look, if I'm pulling back my finger here into extension, I'm going to get to the point where it's going to get a little bit uncomfortable because my brain's saying, hey, what the hell are you doing? So it's expressing a little bit of discomfort there. I haven't injured anything, I haven't damaged anything, but I've just tipped over the threshold for protection. But now if I'm in a stress state, right, and I'm not able to manage my breath very well, maybe I'll start to experience that protection a little bit earlier, right? I might be a little bit more sensitive to extra stress in my system. So it's not a matter of changing the actual stimulus or the stress of the system, but changing the physiology of your system to be able to make better decisions about what's dangerous and what's not dangerous. And in a nutshell, I think that when individuals are in a persistent state of stress or a persistent pain experience, they typically tend to interpret things as threatening or dangerous when they're not really dangerous at all. So it's not a matter of changing the stimulus, it's changing your physiology to make better decisions about what's dangerous and what's not.
Yeah. Yeah, man. I mean, we live in a time where we have constructed, we've taken a primary emotion, fear, and instead of that being something from a sense standpoint, it's a self-generated prophecy, right? It's a story that we're creating that then carries the same physiological reactions that seeing a bear or a snake or something that's actually gonna come out, you know, that could harm me. And I'm not saying we shouldn't have this ability to construct these things. It's just a lot of this stuff, because we're in pain, we start to overthink that stuff, and we get in, we put ourselves into these high sympathetic states for prolonged periods of time. And I mean, I've looked at I've seen the data on stuff on fear. It's not quite out yet, but you know, I've seen the data to where you take somebody who's, let's just call it the upper echelon of dealing with fear or high stress, take an operator at the highest caliber, whether from dev group or you're talking, you know, somewhere else, right? They go into this lab, they're studied, what happens with their response? They go to the same place the person who's on an epic ton of medication for anxiety goes, right? Who deals with high anxiety. They go to the same exact place, except they come right down. And the other person stays right up top and is constantly thinking about it and over analyzing what's going on. This isn't to suggest that we shouldn't find compassion in what we're dealing with and looking at. It's just understanding what we're dealing and looking at. And so everything in between that becomes, how do I get my patient, client, myself, to go into this high stress situation and learn to come down off of it. And this is the essence of what I've talked about in all training. At the heart of all training is the ability to make a better decision. Mm-hmm. And that is what we're trying to get somebody to understand with, hey, if I'm in pain here, why am I in pain here? What's going on? What's my strategy for reorganizing this and finding, I'm finding more range when I'm actually in a better position, and then trying to work through that with my breathing, telling me exactly where that's at, right?
Yeah. Yeah, you're almost proving to your nervous system that you do have the resources to make better decisions in that moment. Like on a moment-to-moment basis, you're getting snapshots of your body.
We do, man.
And is your body in a position to respond to the stimulus well? Because if not, then it's probably going to, I almost think of it as your nervous system being too conservative. You know, like it's going to express pain, it's going to express protection in high tone, just because, again, it knows that you don't have the resources or the capacity to make those better decisions. And that, I think this all kind of comes back to what you do at the very beginning of a consultation with a client, is helping them reframe how they perceive stress, helping them not demonize stress, not think of it as a negative thing, but understanding, where do we need stress? Where do we need to build some stress tolerance? And throughout the body, from an input standpoint, where do we need to give stress to? But also, again, how is your body managing stress as a whole? And the best way to have an influence on that is getting an insight into your breathing coordination, your breathing patterns. How can you manage your breath to be able to make better decisions?
Yeah. I mean, it really lays down to, I mean, the whole thing is, this is about energy. Mm-hmm. And everything is about moving energy. We have to move energy. That's all we're doing. We're not making it, we're moving it. And the ability to move that energy efficiently sits under laws, right? Like, I mean, it's efficiency. And so the system's going to figure out in one way, shape, or form how to get efficient, right? And this is where the tripwires get set up, to where we fall into these patterns of, this is just what I do. This is how I work or get around this. I limp around, and, you know, and this is the strategy I'm coming up with because I don't understand what is happening. And this is where our jobs come in, to showing people, here's where you're going wrong. Here's where the pain, even though the pain's here, it's starting here. Mm-hmm. And we need to focus here, and we can use this thing for moving the energy that is our ventilation. This is breathing. This is how we do this.
Exactly. Yeah. I think for everyone out there who's like a therapist or any kind of like a movement or rehab therapist, like, always keep those things in the back of your mind. Like, how is the individual managing stress, and think about what are the main sources of stress in your body. You've got gravity and you've got respiration. With respiration, your rib cage is moving, you're constantly stretching tissues, you're constantly loading tissues, and so that's always feeding back up into the system. Okay, so that's a kind of a layer as to where you're maybe not delivering enough stress. Where are you actually taking your rib cage through its full excursion? Are you exposing the nervous system to its ability to load both ends of the spectrum through inhalation and exhalation? And are you actually able to manage the physiology as well? So, you know, you can get an awful lot out of, you can have a really good kind of platform or framework before you get into the kind of the complicated details about what that specific joint's doing or what that specific muscle's doing. Look at the rocks first almost, and you'll probably find that you create a massive change before you actually try and make it complicated. Because like in your case, like, if you've got tightness or tone here, is that a case where there's tissue problems there, or does your nervous system just feel the need to express tension there because you've lost the ability to manage stress through the upper limb and the ability to make good decisions about what that load is? You know, it's really not complicated, you know?
Yeah. No, it's not, but it's, you know, we are a complicated species in that we create all of these, we have the ability to self-create responses to what's going on, right? Versus really honing in on what might be happening right now. And, you know, the cure for anything is understanding. But the problem is that we seek relief instead of understanding. And so we've got to give people both, because when I'm in pain, I have to give somebody some sort of relief, but hopefully I can get them interested enough in what the problem was so that we can get an understanding or a learning process of what happened, right? Here's what happened, versus them not caring enough and just wanting the relief and just seeking the medication or the Band-Aid in order to just continue on in the current state that we're in or they're in.
And we sort of look at that through like two different lenses. Like when a client comes to see you for the first time, we have to understand that the client has these cognitively generated goals where they want to achieve something. Like if they're coming to you for knee pain, you got 10 people with knee pain. One person can't walk up and down the stairs. One person can't run 5K. One person can't get out of the car. One person has pain in bed. Again, they've all got different cognitive experiences, but we do have to understand that there's the nervous system's goals as well, and the nervous system's experience, and the nervous system just thinks in terms of protection. So I would always step back and say, okay, what are the qualities that that individual needs to express to prove to the higher parts of the brain that we can protect ourselves. We can express these mechanisms throughout the body, through the breath, through the loading capacity, through the tissues, to protect our body from excess stress. And when we lose that capacity, then maybe the nervous system is going to step to the forefront and say, hey, you're not doing a good job of protecting yourself here, so I need to express pain to alter your behavior. And so it's about, like you said, understanding the client's cognitive goals, their experiences, but then merging that with the nervous system's goals. And I think it's an easy way to look at it, because then we don't get caught up in trying to complicate things and looking for all those minute details in the minute details in the tissues, but look at the big rocks and then look at the tiny grains of sand, and how can we merge those together, you know?
That is that absolutely. We getting people to understand their biology holds the answer to just about every problem they need to solve, and really using the things that we're now understanding are a direct shot to that. And that's respiration, man. That nervous system, our dimmer switch is with breathing. We get to, I mean, you can dampen or turn that up and look, we're talking about it dampening a lot, right? But there's a time to turn that sucker up and on.
Exactly.
You know, and getting people to understand that it's okay to go there, but what we got to is how to bring that switch back down, and why going through something like a gear 5 down to gear 1. And, you know, I mean, we use something like 3 7-second exhales in a row, like for recovery efforts, and what we use with training. And this is not, you know, maybe not a PT setting or sports medicine setting, but from a metabolic standpoint, we know that if I've got 3 7-second exhales in a row, that I'm pretty well recovered and ready to go again. That nervous system is calmed down a lot for me to allow for that.
That biofeedback is key. Yeah, that's huge.
Granted, that may not be my CO2 tolerance test of, you know, 1 minute and 20 seconds, but it's definitely, from a metabolic standpoint and training perspective, I've got somebody who's parasympathetic dominant now, and we can actually rewire and go back up to sympathetic.
Exactly. Yeah. And even from a therapeutic standpoint, like if you're working through like a progressive loading approach, someone has hip pain, you're trying to load those tissues that aren't experiencing load, and you're getting them into positions, and you're kind of worried about, are they in a position to handle that stress? Use those different tempos, those breathing tempos, to get an insight into, are they capable of adapting to the stress that I'm delivering to the system? Right. From an isometric loading standpoint, can I progress to the next stage? Use the breath. Don't just use tests that look for weakness versus strength, but use their physiology as another window into their ability to progress through sort of that graded exposure approach. You know, it's crucial to have a couple of different windows to identify change, to give the client an understanding that, hey, I can check this as well. Like a client can't check if they're weak or strong at home. Right? If they can actually have their own biofeedback markers to say, hey, I'm actually doing better at that now. That just gives them hope, and that gives them that sense of optimism that, hey, I'm making progress, because you're looking at progress through different layers.
Yeah. And I mean, this is like in our 101 course, which is a basics principles based introduction to performance, the performance side of this. And you just have to be creative as a PT if you actually want to do it. If you do it and just seeing how we're using it in our performance setting, but you know, it's the creativity around this is so, like, you have an ability to really go a lot of places with it. And it's not restrictive to something like 3 7-second exhales. That's just something we're using, right? So you could actually pull that back to something like 5-second exhales. It's the prolonging of that exhale that becomes important to understand, you know? And so breathing is just one metric in something that we use within the course of triangulation, and understanding that and getting people to go, okay, so you're talking about all this breathing, you know? Well, so yeah, there's breathing, right? But there's also like understanding your own movement patterns, or just using something like flexibility. Like, how's your flexibility today when you woke up, or before you trained, or before you did something? You know, are you walking? Do you find yourself stiffer? There's an instant indication of biofeedback.
Yeah.
How's your brain today? What's your mood when you woke up today? That mood is a hell of an indicator of what's going on, right?
Absolutely.
So my breath, my mood, my mobility, I've got 3 variables that are going to tell me exactly where I'm at any point, you know? And it's as simple as I'm warming up to do something, and all of a sudden I needed to switch to mouth breathing a lot sooner than I did the day before.
Yeah.
Oh,
yeah.
I can't take that on. And that just tells me heart rate training went out right the door right there, because my heart rate is still the same. I don't understand where my, you know, like, oh, I'm not aerobic. I'm not as aerobic anymore. Right. Like, you know, there's plenty of things we've done where we've seen where it's like, you know, you take a high performing athlete, and it's like they can perform at, you know, 140 beats a minute on an assault bike, nasal only breathing, and then it's over, right? The moment it gets above 140, they're mouth breathing. In 1 month, we've got them at 170 beats a minute, and they're nose breathing, and they feel like they could go forever. What's going on?
Yeah.
You know, I'm not suggesting they're totally aerobic at that standpoint, but the fact of the matter is we've changed something very, very metabolically. There's something going on massively metabolically, and this goes taking what happens at an elite level and going, hey, I've got my client who just walks. Well, how are they doing on that walk with just keeping their mouth closed?
Yeah.
Right? That's the difference. That's same, man. Let's get them more efficient metabolically. And we're going to see profound results with inside tissue and cognitively.
Absolutely. Cool.
Yeah.
All right, Brian, I think we might wrap this up, shall we?
Yes, sir.
And do you want to give the clients, or the listeners, I should say,
The clients, that's all right.
Oh yeah, too used to treating clients all day long.
Yeah.
Do you want to give the listeners kind of an insight into where they can find out more about you, if you have any other resources that we kind of spoke about today?
Certainly. So, I mean, look, we're going to send out a mailer to the list. We're going to give access to everybody that actually joined up on this to PSE Pro, which is our platform, for free for a month. So they can just go in and see how we use the gears. A lot of the stuff that I'm talking about, that we've talked about, we're inserting our education from webinars onto this stuff. And so it'll be at very low cost, if not free, to subscribers. So giving them that access to see how this is going to work. We also have our Art of Breath course, which is online, obviously. That's a basic introduction to the principles-based approach to performance. We have a webinar coming up that is the 3-part series on CO2, which is the harnessing the stress molecule, understanding it, bringing a couple researchers into that. Then I'm doing an N=1 at the end of that. So we're actually applying all the information to a testing platform for themselves to experience and understand these things. And then we've just launched our skill of stress, which is if you're working from more of a trauma-based approach, and this would be probably pretty interesting to a lot of the PTs and sports medicine folk, is this skill of stress course by Emily Hightower is an integrated approach to using breathing and breath control into the psyche of those experiencing trauma and pain, etc. And what she's done with that. It's an incredible course that she's put together, and I think would be very, very applicable to a lot of this crowd.
Awesome. And this definitely won't be the last time we do work together, Brian. We'll definitely
no, man.
More out there together as well.
I foresee a very good future with us.
Yeah, and from our side of things, guys, we have a lot of online courses on our website, and we're offering 10% off all those online courses for anyone that's watching this here now. And so all you have to do is use the code webinar10, webinar10, for those courses. So webinar10. And we do have our breath coordination course as well, which goes through some of these principles, looking at the strategies a client might use at the rib cage through an overcoming strategy or yielding strategy, how we can actually affect the coordination of these midline segments, taking it into different loading strategies, so the upper limb and lower limbs, and just give you kind of a fresh insight into how you can actually assess breathing and then guide your rehab process using different breathing strategies, but simple breathing strategies as well. From a coordination standpoint, because we put an awful lot of emphasis on what's happening at the midline, the head, the rib cage, the pelvis, the spine, and how does breathing influence all those different structures, right? And then how can that feed into our clients with pain experiences like back pain, neck pain, even shoulder pain and hip pain as well. And so it's important to understand how breathing and the neuromechanical effects of breathing, how that influences those tissues as well. All right, so again, webinar 10, if you want to get access to 10% off those online courses. But like I said, again, this won't be the last time you hear from myself and Brian, because I think it's really, really important for people to get access to these principles and these strategies, because it's such a low-hanging fruit in the movement and rehab world. And I think that it's something we all started using a lot more. We can facilitate much more change with our clients and with ourselves as well, most importantly, first and foremost, you know?
Yeah. I mean, we wouldn't be chasing this if the feedback was not what it was. But just the amount of people that we get influxed on a daily basis that are like, how much this has changed them. And I mean, for somebody in a clinical setting to not be using this tool is just like, it's so simple to start with and just run with it. And that's, you know, like we'll be emailing everybody who signed up, and they'll have access to see exactly, like, go participate in the training and see what it does with the gearing structure around it. And you'll start to see these changes for yourself. And that's the most important thing, so that you understand. When you understand, you can then go out and apply and really do this stuff. So we'll have a lot more coming with this, and you know, I'm looking forward to building this relationship.
Absolutely. Yeah. And guys, feel free to share your feedback as well. We'd love to know how you guys found this, and if you want to, again, share it with your friends and make sure that we can get this message out to everyone. And hopefully we'll all chat again soon on this platform.
Yep. Yeah.
All right.
Thanks, Ryan.
Thanks, Brian. Thanks, guys, for listening in. Take care.
Bye-bye.
Bye-bye.